So now I want to move to the next section of this implementing effectiveness and introduce two speakers. Naomi Kaufman-Price has been involved with Open Notes as a patient and then as an advisor in the Northwest Open Notes Consortium since 2014. And she's going to provide her perspective. Following Naomi, Marcia Sparling from the Vancouver Clinic in Vancouver, Washington, will provide her perspectives on the work they've done tracking note opening rates and the multiple improvements they've made. Again, Marcia has been involved in the Northwest Open Notes Consortium since its beginning in 2014. So I want to thank both of them and turn this over to Naomi.
Amanda, could I get the first slide, please? Thank you. This started for me when I went to a doctor and my after visit summary, the summary on top said, "Thank you for coming in today." So this is a slight paraphrase. "Thank you for coming in today. If you have any questions, feel free to call." It didn't give me any information on why I had been there, what we talked about, or whether there was any follow-up plan. So I thought there was a lot of boilerplate about getting a flu shot and I don't know, probably Ebola at that time, and a medication list, et cetera, et cetera. But there was really nothing about why I was there. So almost concurrent with that, Kaiser started looking into Open Notes, and I was on Patient Family Advisory Council at that point at Kaiser Northwest, and the notion of Open Notes came up, and we all just jumped on this. All of the people, I think, on that council thought this would be a great tool. They invited me to attend a meeting of the clinician leaders, and I did so. A number of other people spoke in favor of Open Notes, and Kaiser adopted in, I believe that was 2014. I am no longer at Kaiser, but the rest of this is pretty much what people will see on almost any Epic system. Kaiser has done a little more customizing, and I'll talk about that in a second. If you go on to any MyChart, you will, after you've gotten a note saying a summary of your recent visit is available, most do not say your visit note is now available. So you log in. There are a number of tabs at the top, mailbox visits, medical records, and you have to, oh dear, that's my home phone ringing. Sorry, in the background. You have to figure out what it is you want. Do you want visits or do you want medical record? So you just experiment and you go to the visit tab at the top, then says the email says select either past appointment or or the prompt says past appointment or past admission summaries. Now, intuitively, I would have gone to medical record, and I know a lot of people do that, including just yesterday when I was talking to another patient. Then you click on the recent visit, you find the tab, and it then defaults to the after visit summary, not to the notes. You must then click on notes, which to most of us just means an addendum rather than something significant. So the takeaway from many patients, even people who have called up their summaries, I've discovered in talking with people, are that notes are an afterthought, not something necessary. So could I have the next slide, please? On the other hand, some really cool things are happening in Open Notes. This just popped up recently on my prompt, and it said, and it allows me to connect notes with another health system I've visited. So this is a real advance for Open Notes here in Portland, and it speaks to a companion issue, which is interoperability, which is so important as we, great many people don't just see one doctor in one healthcare setting. Okay, next slide, please. All right. When we do go to our notes as patients, we see all kinds of things. And I know that John, I believe, is going to talk a little bit about this later. We have language that can both confuse us if we don't know the difference between aphasia and apraxia and apathy or something. I don't know. That's off the top of my head. But we also see language that can really turn us off. I have multiple sclerosis. The first disease-modifying treatment I was on was Avonex, an injectable, and I have seen notes that say I failed Avonex. Actually, it made me really sick. And then there was recently a Twitter discussion on language in notes, and I really love the first one. I won't read all of these to you, but the note from an oncologist said salvage mastectomy or chemotherapy, and the patient told the doctor she was not a shipwreck. So when you use language in notes, it really, please try to remember that this is a partnership, and this is going to be really ongoing as Open Notes develops and adoption read rates increase. Next slide, please. This is just self-explanatory. The first one deals with an actual error, or not an error, excuse me. Again, language denies ever smoking, and which implies that this person was lying about cigarette use. Now it says never a smoker. I had to go round and round with my provider on trying to get my notes fixed because my history said that I had never smoked. Well, in fact, I did, and that's something that did super past tense, but nonetheless, that needs to be in my notes. One challenge is getting your notes changed. We should think also about weight. Not every woman I know, when they see the word obese, much let alone morbidly obese or even overweight, they just shut down. It is probably sufficient to note someone's weight and, if you want to, BMI, and it's not going to be any news to them. Also, in terms of language, using diagnoses as labels. I have diabetes versus she's a diabetic. So, she has diabetes versus she is a diabetic. This I don't have diabetes, thank goodness, or epilepsy, but I don't want my diseases or diagnoses to define who I am. Okay, next slide, please. This slide will be on the record from this. This is from a journal called Diabetes Care from October 2017. It's a wonderful article on the use of language in diabetes care and education, and it has a great chart on common terms, alternatives, and why. Next chart. Next slide, please, Amanda. And then in looking towards the future, I really hope that in addition to clearing up two things on the portal. Number one, I would really like for the prompts to automatically default to the Notes tab, not to the After Visit summary. Part two is that I would like providers to make it clear on visits that you will be getting an email with the prompt to the visit note. I had a really interesting discussion yesterday with a woman been treated for breast cancer, and she had no idea she could access her visit notes. She did right then and there on her phone, and I could barely have a conversation with her after that because she was absolutely transfixed, and was so grateful to see that. And so in the future, we really do need to have some clarity on what an ability to jump directly to the notes. We also need, if people are just going to that home page, to clarify visits versus medical record. You cannot get your visit notes under your medical record unless you download your whole record. That's not what people generally want to do. Looking forward to what might be coming next for all of us, I thought this was really fascinating. Dr. Aaron Gray in Missouri on Twitter predicted that we are going to have recording clinic visits with an Alexa or Google or Apple Home type of device will revolutionize data coming out of visit. So doctors won't have to spend time documenting. It's already being recorded. And patients could play, this would be simultaneously into the record with patient access. And I can't tell you how important this is following anything where you're supposed to, a visit where you're supposed to do follow-up that is more involved with making a simple phone call. And I can really see the day when these voice-activated devices will be a tool for open notes. And I believe that's my last slide.